The concern with belly fat is almost universal, and so many times, so many of us have looked at ourselves in the mirror and thought that without the belly fat, the belly would look so much better. Abdominal liposuction is a great procedure to get rid of the resistant fat that is resistant to diet and exercise. I am Dr. Shilpi Bhadani. I am a plastic surgeon practicing at SB Aesthetics, Gurugram, India. In this video, we will be seeing several cases of abdominal liposuction and how one can achieve the desired shape around the belly by getting rid of that excess fat through this procedure. When we are looking at a belly which is like this, you can see that the person is lean, but the resistant fat around this area, around the abdominal area, obviously it is difficult to get rid of this fat, and that is why it is resistant. So when we are looking at a procedure of abdominal liposuction, what does it achieve? It basically achieves the reduction of the deep fat. If we additionally require some extra contouring or an athletic appearance, we do some abdominal etching also to achieve a little more high definition. Now here you can see that we have done abdominal liposuction, and of course, as you all know, I have told this many times in my other videos, you've seen procedures also, that abdominal liposuction is a procedure which is done through very small cuts, and the cuts are somewhere here. And you can see this is the cut that we have made so that the cannula can enter. Even here you can see a small cut. So this is all that the scars look like. This is all what the scars look like in an abdominal liposuction case. And through that we have been able to achieve, and this is almost a 3 months post-op case, 3 to 4 months post-op. And here you can see that the abdominal fat has reduced, the belly has achieved a much better proportion. Here the waist definition has also come, so we've done the flanks also, and a little bit of the bra roll and the mid back area also has been done. So here you can see that there is such a large change in the contour. Even here in this view also you can see that the abdominal area is much more flatter, and the waist area is also much more straighter. When we come to another case, here again you see that the rolls have been taken care of, the flank fat, the abdominal fat. So obviously it's like a 360-degree contouring where we can also address in the same procedure the lower back area, the mid back area. Although in this case I would like to point out that yes, there is some pigmentation after the procedure which eventually improves over time. So when we are discussing about the procedure, we do tell the patients that there can be fallouts of this procedure, but then most of them are temporary. This is another case. Again you see that the abdominal fat has been taken care of, the abdomen area looks much leaner here and much more better shaped. Of course there's still swelling. This is about a 2 months post-op. The scars are, I think this is a little more earlier post-op. The scars are still fresh. And here also you can see that the area of the belly which was earlier having a disturbed contour is much more smoother and much more better. Of course the skin looks a little red, inflamed, and it takes some time to settle down. Another case, and this is almost about 5 months post-op, almost settled from the procedure. Here also you can see that the waist area is much more defined, the abdominal area is much better in contour. So basically what we are looking at is change in the contour of the abdomen. It's not that if you gain weight then the abdomen area will not increase. It will increase in fact, but if you gain weight from this state, obviously it is going to look much worse with weight gain. But when we have improved the contour, even when you increase your weight, the improved contours remain there and you gain a bigger size in the improved contour. So that is permanent about liposuction. The shape change that we give with this procedure is almost permanent. Here also you can see this particular lady, she has lost a lot of weight, and you can see that there's little hang in the tummy over here, in the lower part also, over here also the flank area is slightly more pronounced here with fat, and you can see this is about 2 months post-op. Here you can see that the area is much leaner, and obviously the contour of the abdomen is much more athletic, and when you see here you can see the abdomen divided into sections. We've been able to achieve a decent contour. And of course in weight loss patients we do say that for contour improvement you may require a secondary procedure for better definition and better contouring. I would like to bring your attention to this particular case, wherein here the fat was quite resistant, and from this to this, obviously there's a lot of fat that has been removed, but we can still see some contour defects here and there. And here you can also see that we've tried to achieve an HD contouring, and this midline groove is starting to show now. And as the patient goes back into her exercise routine, this is going to look much better. And obviously you can see that the fat has been removed well, and the contour has been achieved, and it is pleasing now. So all in all, when we talk about abdominal liposuction, we are talking about recovery time also. When you see from here to here, this is a very early case, just about 2 days post-op. You can see the bruising. Sometimes people get scared with all this bruising, but then this is temporary. Until unless you land up with a skin burn, this is temporary, and it improves a lot in 10 days time. Burns again can occur if we are using energy devices, but then we have to be careful in using them. They have their own advantages, but then we have to always explain that there can be fallouts from the procedure also. It's not common, but yes, when we are using power devices or energy devices, there's always a risk that it carries along with itself. Although we've been doing multiple cases, and so far it's been uneventful, and we are actually loving our results with the power devices. We have ultrasonic lipo, which melts the fat, and a power assisted device which actually removes the fat in a complete manner. So obviously there's a recovery time associated with every procedure, and you must be ready to handle the swelling for about 2 months, 3 months. Sometimes people take longer, but your body will start settling in about 6 weeks time, and it looks much better, less swelling. 3 months it looks much better, and 6 months is when we want to stop and assess the result. Of course, we tell our patients to go back to their exercise routine in about 10 days time, slowly and steadily, and in around 2 months they can do all the exercises that they were doing, even strenuous ones. So I hope that this video will be helpful in your understanding of abdominal liposuction. If you're planning this procedure, you can drop in your comments in the comment box below, and I shall be very happy to answer them. We have several videos of abdominal liposuction, procedure videos and explanatory videos also previously posted on our channel. Thank you for your viewership. I cannot thank you enough. We are close to reaching 35,000 subscribers landmark, and I'm really thankful for sharing our videos and actually liking them. I'm also available on other platforms like Instagram and Facebook. You can also reach us via those, and of course our email and phone numbers have been given below in the description box. Thank you so much for watching this video.